90 years ago, we thought we had our answer, tuberculosis, the world's first TB vaccine. Then, a new drug, our cure. Then, we got complacent. Now, we have a global epidemic. Airborne, contagious, deadly, and evolving into a superbug that's getting even harder and harder to treat. We're more exposed now than ever before.
MDR-TB is not like normal tuberculosis. I was resistant to 7 drugs. I can remember moments during treatment and thinking, I can't do this anymore. I don't know that I'll make it through this.
Every clinician is aware of the need for a newer vaccine, but then there's no option.
We must maintain this momentum because otherwise it will put us back decades, actually.
I'm appalled at the level of our complacency.
The number of people that have drug-resistant tuberculosis is going up, and nobody's talking about it.
How can I sit back when every 5 minutes a child is dying of TB? It would be criminal.
What we've got to do is not say, oh, we're going to make this a little better. We've got to essentially transform the entire field.
Good evening and welcome to this fantastic setup with the Capitol just in the background. So it's a real pleasure for me and Ambassador Gooseby to welcome you all to this special event. Continuing with our evening, we wanted to recognize another country-led champion who has helped make tremendous progress in the battle against tuberculosis, the Ministry of Health of Indonesia. Indonesia is a leader in the fight against tuberculosis. The country has made great progress, having met the Stop TB and Millennium Development Goals for tuberculosis in terms of prevalence and mortality. Indonesia has demonstrated tremendous leadership in introducing new diagnostic techniques at national level and constructively advancing partnerships with the private sector and other service providers. Thanks to the thoughtful and proactive leadership demonstrated by the Ministry of Health and the government of Indonesia, we have seen the expansion of GeneXpert nationwide and other diagnostic technologies that have made a tremendous difference for improving care of patients with multi-drug-resistant tuberculosis. We are very lucky to have here Indonesia's ambassador to the United States, Dr. Dino Patti Djalal, who will accept the award on behalf of the Republic of Indonesia. Dr. Djalal. We'll have it ready for you.
Thank you very much, Mr. Ariel Pablos Mendez, friends from USAID, and all the guests who are here today. I'm very proud and honored to receive this award on behalf of the government of Indonesia, and especially on behalf of Minister of Health, Nafsiah Mboi. I was in Hawaii about 2 weeks ago when the Department of Health from Indonesia called me and alerted me about this award, and they were just saying, okay, we're not sure if the minister can travel for this award, but please be ready. And about 3 days ago, I got a call from the office of the president, and they gave me the instruction to receive this award on behalf of Minister Nafsiah Mboi. But the point is, this is something that even the office of the president takes very seriously, and I feel a lot of pride in receiving. So this is very much a big deal for us. and it only reflects the close cooperation that we have been able to build in recent decades. For us in Indonesia, health is a very important sector. It's the largest government budget is allocated for health, and we have a lot of health workers throughout Indonesia. Indonesia is a country of 250 million people, 250 million, and spread over 17,000 islands, spread over 3 or 4 time zones. So it's a huge area. We still have lots of poverty, about 40 million people living in poverty, a lot of rural areas. So it's a tough environment for our health workers. A lot of them work with very minimal salary, probably about $100, $200 a month, and they have to work through the very difficult terrain. My wife, Rosa, who's here, also works in a remote island. She's also a doctor. And by the way, thanks for reminding everybody that I'm not a medical doctor, because if anyone faints, I can only pray for you. Right? Yeah. But in Indonesia, we have all kinds of diseases, dengue, HIV, and TBC is a big challenge, and I'm glad that our efforts to fight TBC has been recognized by USAID. We have been able to halve the mortality rate related to TBC from 53 per 100,000 to about 27 in about 20 years between 1990 and 2010. And around the same time, the prevalence rate of TBC has also reduced by about 40%. So we've done, we've done a lot of work, and we are very happy to receive this award. Now, the other point that I want to mention is this: as ambassador of Indonesia to the United States, we hear a lot about the U.S. rebalancing towards Asia, and there's been a lot of talk about the boats, the Marines, the soldiers, the carriers, and also in the context of that, the FTAs, what they call trans-Pacific partnerships, the business activities, and so on and so on. But this is an area which has hardly captured public attention in Indonesia and in the United States, because all the talk about the boats, the carriers, and the business engagements. And sometimes I want to scream that, look, the United States does a lot more than these things. The United States is a pioneer and a champion on issues of health, which affects the livelihood and the well-being of real people on the ground. And this is where I really like to thank USAID for all the great work that you've done in Indonesia especially, but really throughout the world. I've met a lot of USAID people in my 2 decades of service in government, and these are very, very special people. They love America. They represent the best of America, but they also have one commonality, which is they love the country where they're assigned to. They wake up, they do the day and sleep thinking about how to conduct their work to benefit the people where they're assigned to. These are very, very special group of people, and I think America should be proud, and I think the work that they do, even though they don't make it on page 1 of Washington Post or New York Times, but the work that they do is the one that is mostly felt by the people on the ground in these countries. And it is the work that they do that made people understand and realize that when America does to the world is spreading the power of good, the power of American idealism, and the power of American can-doism. So on behalf of the government and people of Indonesia, although this is about us, but this is also about you. Thank you very much.